So the challenges that Boston Medical Center faced before Qventus was implemented were primarily with identifying patients who were there longer than their expected length of stay and reasons that they were there in the hospital. We were not able to identify exactly who those patients were and why they were there. And primarily, in my view, it was because we didn't have a standardized way of discussing those patients at the multidisciplinary rounds. It wasn't standardized, it wasn't structured. So capacity was the number one problem, and we needed to solve it like ASAP. It was a tool. It wasn't the solution. So we kept insisting to folks that here we have a tool that helps us guide the conversation for our daily multidisciplinary rounds. So it created a script for us to follow. It created a standard structure. So now we had a set time for all teams to come. They had a script to follow. There were set expectations. It was very clear what they needed to do when they came for rounds. And it also identified the roles. I thought that was very helpful, where Qventus identified who's going to actually lead rounds, who's the note taker, or the fact checker, I think is what Qventus calls that individual. So we were very impressed with the structure and even the role clarification of members at rounds. So it was evident to us that would be a very useful tool even from the get-go. Well, the patients definitely staying longer than what they needed to be in the hospital brought its own challenges. From a patient perspective, there was an increased risk of falls, infections, hospital-acquired conditions. From an institution perspective, we were not able to provide timely care for patients awaiting the ED. Earlier initiation of care is definitely related to a better outcome for patients. So that was lacking. So all around, it wasn't a good situation. I think the 9% decrease in excess days clearly is an advantage for us, because it helps us go with tackling the issues that affect patients the most. And it's always been helpful for us to show the data for folks, both for the operational folks as well as for the clinical folks at the front line, to say, here's the impact that Qventus has brought.